we ought to be really proud. I mean, for 2 decades now, there's been progress in awareness about how much better care can be, a growing sense of the fact there are examples around the world that we can draw on, and not running away from the problems of quality. But when you think about the real need, which is to have excellence at the highest achievable levels everywhere, and beyond that, to connect health and health care more securely, we have a long, long way to go. So I would say those issues of spread and breadth still confront us. It's a very difficult time for hospitals and leaders in healthcare today because the signals are mixed. We're still mired in a lot of ways in the history of fee-for-service care, of revenue-based business models, of doing more, and incentives aligned that way. On the other hand, there's this growing interest in really doing better and adding value and helping communities thrive. And that's frankly a different business model. And I'd say we have not crossed that bridge yet, where we kind of know we have to, but the next few years are going to be crucial as to whether really we're going to get authentic about what the Institute for Healthcare Improvement calls the triple aim: better care for everybody, universally, better health so people aren't getting sick in the first place, and lower per capita cost, which is an urgent agenda in our nation and frankly in most of the developed world. Yes, last year at the Institute for Healthcare Improvement's annual National Forum, I spoke a good deal of discoveries I had sort of been making personally through mentorship of people who are interested in mind-body relationships, the idea of awareness and self-actualization and its relationship to health and well-being. And I've become more and more convinced that that isn't just a good idea, it's scientifically correct, and that the way we think, the way we choose to work on our own self-awareness really matters. And I think it's a very important idea. I don't intend to stop pursuing it. It was a marvelous experience. I enjoyed so much of it. I enjoyed meeting the people of in my case, the Commonwealth of Massachusetts, the citizens out there. Their heads are in the right place. They really value the success of their communities. They care about each other. It was very affirming. And really seeing up close the connections among the different elements of our society, the different processes and communities, and how really tightly connected the issues are that affect people's lives: transportation, education, poverty, social justice issues, and healthcare. It broadened my vision of what it's going to take to create the kind of communities we want. Absolutely fascinating.